that this is a global crisis that requires global cooperation and response if we are to keep all of us safe and if we are to keep Canadians safe. At the same time, I can assure everyone that the federal stockpiles have been sufficient to meet the needs of the provinces until this point. And in the coming days, we will be receiving millions more items that are necessary right across the country, at the same time as our businesses, companies, and manufacturers are tooling up production to make sure that we have enough, not just for Canadians, but for friends and allies around the world who need it.
That was the Prime Minister answering a question today about Canada sending 16 tons of medical equipment to China back in February, where the coronavirus outbreak, of course, began. It has since spread rapidly across the globe and throughout this country. Justin Trudeau says stockpiles, at least right now, are sufficient, and manufacturers are working on keeping it that way. That's the political perspective, but what does it look like on the front lines of this crisis? Dr. Jane Philpott is the former Minister of Health and has started practicing again in Ontario in the wake of this pandemic. She joins us from Markham. Hi, Dr. Philpott. Nice to see you. Thanks for making time for us.
Nice to see you, Vashti, although not under these circumstances.
No, I wish it were under better circumstances, certainly. Let me start off on the front lines. You have began working, my understanding is, at the COVID-19 Assessment Center at your local hospital. Tell us what we should know about what it's like.
Well, as you know, there are now dozens of assessment centers across this province and certainly even more across the country. There's been an extraordinary response from the entire health sector in terms of ramping up, addressing the people that are coming to be seen and also preparing for even worse days ahead. So at the assessment center where I have been helping out at Markham Stouffville Hospital, they've done an extraordinary job getting everything ready to go. We've seen hundreds of patients there already, but there is a sense of not knowing where this is going, and every day the numbers are looking worse, and so certainly there's a somber mood.
Let me ask a bit about that sense. I read the op-ed that you wrote a few days ago, and you were talking, I guess, about sort of how this compares to other things that you've either been through or witnessed in your life, or even as a physician, and I'm thinking particularly of SARS. What would you tell our viewers about how this does compare?
Well, you can see that today in Canada now we've reached 39 deaths, and that's almost the number of deaths that we had at the time of SARS. And there's a very strong sense from everyone that we're really only at the beginning of what's going to happen and what this will look like for Canadians. So that's a very concerning trend. We all know the devastation that was caused by SARS, particularly, of course, for those families who lost loved ones. But to imagine that we're now in a scenario where something is spreading very rapidly. There's a lot of concern about the capacity of hospitals to be able to deal with extremely sick patients. And I would say that I've never sensed that same kind of anxiety, but at the same time also seeing a really incredible, positive, hardworking response on behalf of health professionals and the entire team that it takes to be able to run health systems in this country.
There have been a lot of questions and conversations over the past few weeks about the level of preparedness, not only of the system, the healthcare system, but whether or not practitioners will have the supplies that they need, the equipment that they need in order to combat what is expected to be an increase in the number of cases and the number of hospitalizations. What is your sense of that level of preparedness right now?
Well, I think you're absolutely right to have captured the sense of concern from health professionals. I can tell you at Markham Stouffville Hospital that at the moment things are tracking well and we do have good supplies, but there's certainly many stories of other centers that do not have the same. I can tell you on the basis of my work supporting Anishinaabe Nation, which is 49 First Nations in Northern Ontario, that there are nursing stations in the north that do not have any surgical masks for those nursing stations. So yes, supposedly the supplies are out there. There are apparently many more to come, but I believe that people on the front lines need more assurance. And I would say that this is probably an area that I think is one of the greatest reasons why hopefully we'll be looking at even stronger measures, including the possibility of using the Emergencies Act in order to ensure that there is a a huge national effort, an operations center that can make sure that those personal protective equipment essentials get out to the front lines where they're needed.
Can I ask you to expand on that? So you think that the federal government should invoke the Emergencies Act, and can you be specific about what you think the best use of it would be?
Well, there are a number of advantages to using it. You may have heard today that Dr. Smith, who is the CEO of the University Health Network, is one of many voices that has called upon the need to invoke the Emergencies Act. One of his comments, which really struck me, is that we won't regret the things that we will regret are the things that we don't do. And you can't look back and say that we didn't do enough. That would be a terrible situation to be in. And one of the areas where the use of the Emergencies Act could be very helpful would be to be able to have a national emergency supply center that would ensure that those pieces of equipment, whether they be ventilators or other intensive care pieces of equipment, but also, of course, the personal protective equipment that will protect our health workforce. It's marvelous the way Canadians are doing a fantastic job, trying to gather little bits and pieces from dentists' offices and hardware shops. But, this calls for a massive amount of leadership and coordination to make sure that people will have the protection that they need. If we don't protect our health workforce, we will be in dire straits in the days ahead.
Do you think it was the right decision as well to apply the Quarantine Act?
Absolutely. Certainly things had reached a point in time where you can't simply urge people out of the goodness of their hearts to self-isolate when they were supposed to. And so these are times where people's civil liberties have to recognize the greater good of society, and making sure that people will respect these important public health measures in order that this is not a greater tragedy than it already is, are things that governments need to be doing now.
Okay, I'll leave it there. Dr. Philpott, really appreciate your time this evening and wishing you and your family the best of health.
Thanks, same to you.
Dr. Jane Philpott, former Minister of Health. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.